as far as some different things we need to watch for during surgery, here is an anesthesia log that we do use during all of our surgery procedures. Things we're looking at are the heart rate, the temperature, respiration rate, the mucous membrane color in the CRT, blood pressure, pulse ox, the ISO percentage rate that we are maintaining that animal at, and also the oxygen flow rate, and then thermal support, meaning what kind of heat source, how are we monitoring a pet's temperature during surgery. Not really monitoring a pet's temperature, but how are we keeping their temperature elevated at that point so that they do not drop down too low. So the way that we do our thermal support is by a tabletop. We have a heated table. Now things that we watch for, like the heart rate. The heart rate, we are watching to make sure they do not become bradycardia or tachycardia. They don't become too low or too high with their heart rate. The rhythm, that is where if their heart rate is too low, maybe they're too deep under anesthesia, or they could be indicating some kind of heart block. Cardiac arrhythmias can indicate pain or they're too light under anesthesia. Mucous membranes, that is, we're checking to make sure they are pink. They're a good pink. They are not blue, not purple, not pale, not white. Those are indications. If they were blue, purple, or pale, then we need to bring that to the doctor's attention and figure out what's going on with that animal. The capillary refill time, otherwise known as CRT, that should be under 2 seconds. The way we test that is we kind of touch on the gums with your thumb, and then as far as taking that off, you should be able to kind of count before it turns back pink again. So usually under 2 seconds is a good number. The pulse and blood pressure, those they should match up. The pulses you can kind of feel behind here, the femoral pulse, and as far as it should match up with the heart rate. So you see the heart rate on the EKG or by listening by a stethoscope, you should hear those matching up. If they are not matching up, then we need to bring that to the doctor's attention and kind of see what is going on. Also, another way you can check those pulses is by whenever they are opened up in their incision, sometimes you can see everything on the inside kind of pulsating in a way. If the pulse is too low or very hard to feel, then we need to do something about that, let the doctor know of what we're noticing, that sort of thing. The respiratory rate. Respiratory rate should be shallow, but it should be not too shallow. So we want it just to be normal. You should be able to see the animal is breathing. Maybe you can indicate through the rebreathing bag, or watching the animal's body kind of move in a way. And as far as if they're too high on anesthesia, that's going to make that respiration rate go lower. Now if they're too low, that's going to make that be awfully, like they're going to really work to breathe, and that's going to make everything faster. Another thing is the body temperature. Body temperature should be checked every 15 minutes, or if they're connected to the EKG machine, then we're paying attention that way. As far as that is just reading monitoring devices, we're constantly should be watching the monitoring device and making sure that everything is in proper working order, but then also that the animal seems to be under a nice healthy anesthesia state. We don't want an animal waking up during anesthesia. We don't want them dying during anesthesia. So those are things that me as a technician here at the clinic, that is my job to make sure that I'm watching all of those things. As far as we want the doctor, she needs to be paying attention to getting the surgery done in a healthy, safe, fast manner. And so she's kind of concentrating on what she should be concentrating on. We're concentrating on what we should be concentrating on, that sort of thing. Here is my dog. I am going to indicate the different reflexes with this dog. So as first, the ear flick reflex. So what we do is we pull up the ear here and kind of mess with the hair, and you'll see the ear will move if indeed they are not under anesthesia that much. The pedal withdrawal reflex is whenever we always usually do the back foot, as far as you're squeezing in between the toes, and if they withdraw their leg, then they are not in a deep anesthesia sleep yet. The wink reflex is as far as we're touching the medial canthus of the eye and seeing the animal's eyelids will retract at that point. You'll see the muscles around there opening up. As far as the corneal reflex, that is the eye looking straight on? Is it rolled back in the head? That sort of thing, indicating if it is straight on, then that animal may not be under anesthesia as deep as we want them to be. We want the eyes to be kind of rolled to the back to be under deep anesthesia. As far as the laryngeal swallow reflex, that is kind of seen as far as if they're swallowing, we want them to not be able to swallow in terms of tubing them for intubation. The jaw tone, that is when you kind of take your two fingers here, and that's going to kind of open up the jaw, and then you should be able to lightly be able with two fingers to open up that jaw. There should not be any resistance if they are under full anesthesia. The eye position, I kind of went through that already, but as far as we don't want the eyes looking straight on. And then the respiratory pattern. With the respiratory pattern, the animals should be in a nice shallow breathing state. If their respirations are really their body's working to breathe very heavily, then they are not under a deep anesthesia. And as far as if they're in the shallow state, then they are deeply under anesthesia where we want them to be. Here is a sheet that we do go by as far as our stages of anesthesia. We kind of match up things and go by which stage is this animal in. So stage 1, the animal is disoriented. Things we should watch for are the respiration. Is it between 20 to 30 breaths per minute? The cardiovascular function, is the heart rate, has it been unchanged? Response to surgery, are they struggling? At that point, they should be struggling if they are under stage 1. Now, if they're not struggling, well, it could be stage 2. So we see they do still kind of struggle during stage 2. So maybe they're not struggling anymore. Well, then we go to kind of stage 3. May not, or may respond with movement. So things like that, we're checking their reflexes at that point. Maybe checking their ear flick reflex, can check their eye position, and then things on here, their eye position at that point should be central or rotated, so opening up the eyelids, are those eyes at that point. So just as far as these are our different stages, of anesthesia that we do try to determine. We want the animal to be between or in stage 3, as far as there are different planes that they can be at in stage 3. So just trying to get them at their happy sedated stage. That's our goal for every patient, is just to be sedated, for the doctor to be able to do the procedure, but then also at a healthy state where the heart rate, the respiration, and everything is just working properly, and that animal's going to be healthy and live through the procedure. The reason that the physiological status and the monitoring statuses are very important and related to each other is it's different ways of determining where that animal is under anesthesia. As far as the heart rate could be off, but maybe they're showing signs of, so let's say the heart rate is wacky in some way, maybe there's bradycardia, but as far as they're not moving some of their reflexes, things like that. So we're just determining different barriers to try to determine that animal as under anesthesia in a safe, healthy way that it should be. And as far as the stages of anesthesia, that is also just helping, you're kind of looking at the animal throughout the whole body, inside and out. We know everything that's going on in the inside approximately, and we know what's going on the outside by their reflexes, their eye position, things like that. The inside, we're looking at the heart rate. We're making sure their temperature's where it needs to be. We're making sure their color's where it should be. Their blood supply's good. All those things, they're just very important in making sure that animal is under anesthesia as healthy as possible, and that they are going to come out of their procedure with no problems.